Welcome to our deep dive today. We're going to be exploring adult-onset neosporosis in dogs, and we're diving deep into a 2024 study from the Journal of Veterinary Internal Medicine.
Yeah, this study looks back at cases. It's a retrospective case series. They looked at 21 adult dogs who were diagnosed with neosporosis at a referral hospital in Sydney, Australia. And the time period for the study is between 2010 and 2023. Now, this study really dives into a condition that we consider a separate entity from what we usually see in juvenile neosporosis. And it most likely comes from the reactivation of a latent infection.
Yeah, one of the things that really caught my eye in this paper was the diversity of clinical signs. The study really highlights how varied neosporosis can be in adult dogs.
Oh, absolutely. And they gave some great examples. For instance, 6 dogs showed what we call generalized myopathy. So that means we're seeing signs of muscle weakness like difficulty rising, having trouble standing, and exercise intolerance. And then there were 7 dogs with multifocal intracranial disease.
So those are going to be our neurologic dogs.
Exactly, yeah. They had symptoms like ataxia, head tilt altered mentation, and even in some cases seizures. We also had 4 other dogs that showed signs that were specific to the spinal cord. So that indicates myelopathy. And in those cases, we saw paraparesis and proprioceptive deficits.
Really paints a picture of how widespread the effects of this reactivation can be.
It does. And to add to that, we saw 2 dogs develop polyneuropathy, and this resulted in progressive paralysis and a loss of reflexes. And then there were single instances of focal myopathy and cerebellar disease observed in the study as well.
Wow. So with such a wide range of symptoms, I imagine diagnosis can be quite a challenge.
Yeah, you're absolutely right. It can feel like you're piecing together a puzzle. But there are some clues, and the study did reveal some key diagnostic clues. One striking finding was that 85% of the dogs had elevated liver enzyme activity, specifically ALT. So that's something that veterinarians should really take note of. That's a pretty high percentage. And in addition to that, 100% of the dogs tested had increased creatine kinase activity, which, as you know, indicates muscle damage.
So elevated liver enzymes and CK could be red flags for vets to think about neosporosis.
Absolutely. They could be very helpful indicators. Now, of course, to confirm neosporosis, all the dogs underwent serological testing, which confirmed exposure to Neospora caninum. But it's important to remember that antibodies only tell us about exposure, not necessarily an active infection.
So a positive antibody test alone doesn't mean a dog is actively sick with neosporosis.
Correct. Now, MRI findings were also quite variable, which adds to the diagnostic challenge. The most common finding was multifocal brain abnormalities. But cerebellar atrophy, which was previously thought to be a hallmark, was less frequent than we expected.
Interesting. So even advanced imaging doesn't always provide a definitive answer. What about treatment? What did the study reveal about how these dogs were managed?
The primary treatments were clindamycin and trimethoprim sulfonamide. Both of these antibiotics have shown some efficacy against Neospora caninum. However, just as the clinical signs were varied, the response to treatment was equally diverse.
So did any of the dogs show improvement with these treatments?
There were some positive outcomes.
Yeah.
8 of the dogs experienced a complete recovery, so their symptoms completely resolved and their enzyme levels returned to normal. However, 6 dogs had incomplete recoveries. They showed improvement, but were left with lingering neurological deficits.
So meaning they might have regained some mobility but still had some weakness or coordination issues?
Exactly. And sadly, 7 of the dogs had minimal to no response to treatment and were euthanized. And to add another layer of complexity, 4 of the dogs experienced relapses even after initial successful treatment.
Relapses. So the parasite can reemerge even after a dog seems to have recovered.
That's right. This emphasizes the persisting nature of this disease and the critical importance of long-term monitoring.
It sounds like there's still a lot to uncover about this disease.
There is. One of the big questions is the optimal treatment duration. This study used longer treatment courses than previously described, partly because of those relapses we discussed.
So we still don't know definitively how long treatment should last to minimize the risk of the parasite returning.
That's the crux of the matter. More research is needed to determine the most effective treatment duration for adult-onset neosporosis, balancing effectiveness with minimizing potential side effects and the development of resistance.
This is a fascinating but complex condition, for sure. Let's delve into some of the other unanswered questions in part 2 of this deep dive.
Welcome back to our exploration of adult-onset neosporosis.
We've already established that this is a rather enigmatic condition, with a variety of clinical presentations and unpredictable outcomes.
Indeed. And one thing that this study points to is a possible link between immunosuppression and disease reactivation. Recall that several dogs developed symptoms after receiving corticosteroids.
So the use of certain medications, particularly those that suppress the immune system, could potentially trigger a resurgence of the infection.
That's a very important point, and it underscores the need for further research to fully understand the role of immunosuppression in this disease. This could have significant implications for how we manage dogs with latent Neosporosis infections, especially those requiring immunosuppressive therapy for other health conditions.
Now let's get to the heart of the mystery. What's the underlying cause of infection in these adult dogs?
Well, the study suggests that horizontal transmission, meaning ingesting infected material, was unlikely in most cases.
So we can likely rule out something like consuming contaminated food as the primary source of infection.
That seems to be the case based on the information we have. This further supports the hypothesis that reactivation of latent infection is the main culprit. But the real question is what triggers this reactivation?
That's the burning question. What flips the switch from a dormant infection to a full-blown disease? Is it stress, a weakened immune system, or something else entirely?
Those are all plausible theories, but we need more research to provide definitive answers. Identifying these triggers could be crucial in developing strategies to prevent reactivation from happening in the first place.
Now, the study also included 4 greyhounds. Is there something about greyhounds that makes them more susceptible to adult-onset Neosporosis?
That's a question researchers have explored before, and the study authors acknowledge previous suggestions of a possible breed predisposition in greyhounds. However, they also cite a recent study that didn't find a statistically significant difference in Neospora caninum seroprevalence between retired racing greyhounds and other healthy dogs in the same area.
So the presence of 4 greyhounds in this study might just be a coincidence.
It's possible larger studies would be needed to confirm or refute a breed-specific susceptibility to adult-onset Neosporosis in greyhounds.
Okay. Let's circle back to the finding about elevated liver enzymes. This seems like a particularly intriguing aspect of the study.
Yeah, the fact that 85% of the dogs had elevated ALT levels is significant. Remember, in the classic juvenile form of Neosporosis, liver involvement is not usually a prominent feature.
So this could be a specific indicator for adult-onset Neosporosis.
That's certainly a possibility. The study authors propose that elevated ALT along with elevated CK could be valuable screening tools for Neosporosis in adult dogs, especially those presenting with neurological or muscular signs.
That could be a game changer for veterinarians trying to diagnose this condition.
Absolutely. It could help guide decisions about further testing and potentially lead to earlier intervention. More research is needed to confirm the reliability of these markers, but it's a promising avenue for investigation.
Now, what about cerebrospinal fluid analysis, or CSF analysis? This is often used as a diagnostic tool for central nervous system infections.
Right. In this study, CSF analysis was performed in 6 dogs. While some abnormalities were found, such as increased protein concentration and pleocytosis, the results weren't always conclusive.
So CSF analysis might not be the most reliable method for definitively diagnosing adult-onset Neosporosis.
That appears to be the case, at least based on the findings of the study. The authors highlight the limitations of CSF PCR testing for Neospora caninum in these cases.
It seems we're still facing challenges in pinpointing this elusive disease, even with advanced diagnostic techniques.
That's the reality of adult-onset Neosporosis. Diagnosis often requires a combination of clinical signs, serology response to treatment, and ruling out other possible diagnoses.
It's like piecing together a complex puzzle sometimes with a few missing pieces. This deep dive has been incredibly insightful. It's clear that adult-onset Neosporosis is a multifaceted condition that demands our attention, both in terms of clinical management and further research. Let's move on to the final part of our deep dive, where we'll explore some of the broader implications of this study. So welcome back to the final part of our deep dive into adult-onset Neosporosis.
Yeah, we've definitely covered a lot of ground.
For sure. From the diverse clinical signs and diagnostic challenges to the complexities of treatment and those puzzling relapses.
Definitely a lot to unpack.
Now, I'm curious about the bigger picture. What broader implications does this study have? And what does it mean for how vets approach this disease in the future?
I think one significant takeaway is the possibility that adult-onset Neosporosis might be more common than we previously thought. Studies have shown that exposure to Neospora caninum is widespread in dogs.
Yeah, right. Many dogs are asymptomatic. They carry the parasite without showing any signs of illness.
But does this study suggest we might be overlooking some cases?
That's kind of a scary thought, right? A hidden threat lurking within seemingly healthy dogs.
Yeah, it adds another layer of complexity to our understanding of this parasite and its potential impact on canine health. Makes you wonder, could these subclinical infections be contributing to other health issues that we haven't yet connected to Neosporosis?
That's a question that needs further investigation, for sure. So what can be done to address this potential hidden threat? Are there practical steps vets and dog owners can take?
Well, more research is essential. We need to develop more sensitive diagnostic tools that can detect these low-grade infections. We need to go beyond antibody testing to give us a more complete picture of what's happening.
So tools that can help uncover those stealthy infections that might otherwise go unnoticed.
Exactly. And beyond detection, we need to explore preventative strategies. Could specific management practices or dietary interventions help reduce the risk of reactivation in dogs that we know are infected?
Yeah, the idea of preventing this disease from taking hold is certainly appealing.
It's a challenging goal, but one worth pursuing for sure.
Well, this deep dive has been a real eye-opener. Adult-onset neosporosis is a complex and multifaceted condition that definitely demands our attention and continued investigation.
I completely agree. Whether you're a veterinarian or a dog owner, staying informed about the latest research in this area is crucial. Knowledge is our most powerful weapon in the fight against this challenging disease.
From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.